Good evening, I'm Adrienne Arsenault.
And I'm Andrew Chang. Tonight, an $82 billion lifeline for Canadians affected by the coronavirus.
No matter where you live, what you do, or who you are, you will get the support you need.
Help for people out of work and businesses that are struggling, but it can't come soon enough.
When you stop working, you stop making money.
This is a decision to restrict entry.
The Canada-U.S. border closes to non-essential traffic to try to stop the spread.
Are hospitals prepared for a spike in critically ill patients?
We estimate that we will run out of ventilators within 16 to 35 days.
The creative ways doctors are trying to stretch what they've got.
Isolated, but not alone.
You can see that he's all right.
Keeping families together through the crisis. This is The National.
Two major moves by the federal government today as it tries to deal with the spread of the coronavirus in this country.
One of them, billions in aid for businesses and workers grappling with the economic consequences. The other, a carefully plotted, aggressive step by both Canada and the United States. So they have agreed to close the border to non-essential travel. That doesn't include trade or Canadians trying to come home. That word, as Canada recorded more than 125 new cases and a 9th death, an elderly man in Quebec. So lots of developments to fill you in on. Let's start with the massive new spending by the federal government to help get Canadians through the financial part of this crisis. David Cochrane begins our coverage in Ottawa.
In these extraordinary times, our government is taking extraordinary measures.
The border may be closed, but the vault is open.
The measures we're announcing today will provide up to $27 billion in direct support to Canadian workers and businesses, plus $55 billion to meet liquidity needs of Canadian businesses and households.
$82 billion to build a financial lifeboat, especially for people who don't get employment insurance. It includes the emergency care benefit, up to $900 every 2 weeks for up to 15 weeks, for people who self-isolate or get sick or have to look after a family member who is sick, elderly, or a child. The Emergency Support Benefit, another new program to give the equivalent of EI to the self-employed or people who lose their jobs and can't get EI.
My only job is to make sure that Canadians can keep food in the fridge, that they can keep a roof over their heads, that they can afford the medicine that they need.
The finance minister is boosting the GST rebate for low-income earners, waiving student loan payments for 6 months, promising a boost to the Canada Child Benefit.
We're working quickly to get money into people's hands so that no matter what happens during this period, they can afford the essentials.
That includes businesses, big and small. There's a 10% wage subsidy for small businesses for 3 months to keep people working. All businesses can defer tax payments until September to keep $55 billion in the economy. And there's the promise of help to come for the industries that need it most.
We're going to actively work with organizations in the oil and gas sector, in the airline sector, in order to come up with approaches that enable them to bridge through a challenging time.
What isn't clear is how long this challenging time will last. All of these measures run for at least 3 months, but the government expects this crisis to last longer than that. David Cochrane, CBC News, Ottawa.
So that's what's on offer, an enormous cash infusion for employers and workers. But timing is everything, and what we hear over and over again, the need is now. Here's Aaron Saltzman.
In the fight to keep Canadians above water financially, small businesses like Alison Griffin's now shuttered hair salon are the front line.
And when you stop working, you stop making money.
But she's still on the hook for rent, hydro, water, phone, internet. Then there's her staff, all freelancers and contractors.
We have people who have children who don't have childcare for the next 4 weeks, and you have to decide, am I going to pay my rent or am I going to grocery shop for 6 weeks and make sure that my kids have food?
They'll be covered by new measures announced today, but there are other problems. Consider regular employment insurance. In order to get it, you have to be officially laid off. But many people have only lost shifts. When they are eventually laid off, unless they're sick or in isolation, they'll still have to wait another week before they can even apply for EI.
What that means is now we're looking at 3, maybe 4 weeks for people without any type of pay.
And it's barely more than half normal income.
That's going to make for a lot of very desperate families. It's not so much that they're falling through the cracks. It's just that this is unfolding very rapidly, and people are going to go without pay very rapidly as well.
Some things announced today require parliamentary approval. The boost to the GST credit and the Canada Child Tax Benefit might not hit families until the middle of May. As for the small business measures, a 10% wage subsidy will help the owner of this Toronto takeaway keep employees on the payroll.
It helps in certain situations, like people who can remain open, it will help you. So it's not a terrible thing, but for restaurants that are closed, it's not going to bring the employees back.
His business is down 40 to 50% here, and his other location, which he had just opened, is now closed entirely. So while today's help is welcome here and here, it's really just a good start. Aaron Saltzman, CBC News, Toronto.
5 big automakers are halting production across North America, and that hits hard in Ontario. As many as 40,000 workers are affected, according to their union, in places like Oakville, Brampton, Windsor, and Ingersoll. It's not just that sales have suddenly collapsed. Union leaders in the U.S. had asked for some closures due to health concerns. Facilities will undergo deep cleaning during this shutdown.
Well, to the new restrictions now being put on who can cross the Canada-U.S. border. While Canadians will still be allowed to return home, non-essential visits for things like tourism will end. And as Catherine Cullen explains, for that shared border, it was a shared decision.
In both our countries, we're encouraging people to stay home.
We don't want people coming into contact because that's the way we're going to win this war.
A war where the border is a front line to try to stop the spread of COVID-19 by stopping so many of the 400,000 people who cross the Canada-U.S. border each day. But officials won't say that they're closing the border.
This is a decision to restrict entry.
Essential travel will continue.
That means no going over the border to sightsee or shop, though it was still being allowed today.
We went through, picked up the vehicle, came back, and on the Canadian side, we're really right through.
For others, the question of what constitutes essential travel is more complicated, like in St. Stephen, New Brunswick, which sits right on the border with Maine.
There's people that go back and forth for work. There's people that have family members over there.
The specifics are being ironed out, but one thing is clear.
It is essential for Canada and the United States to continue to maintain the very important trade between our two countries. There was not even an atom, a molecule of pushback on that.
Trade is key here.
It won't affect trade at all, and it was just something we thought would be good for both countries.
Canada already shut out much of the rest of the world Monday, but waited on only the United States, despite the fact the country is struggling to manage or even track its COVID-19 outbreak. Canadian officials had to weigh the risks of the virus spreading over the border against Canada's dependence on the U.S.
The food that goes on our shelves, the pharmaceuticals that we will require, are all part of that international trade between our two countries.
Officials are still sorting out when the border restrictions would start, with talk of reassessing after 30 days. Though Canada's top health official today said that the virus could be around for months and that Canada should prepare for a second wave. Catherine Cullen, CBC News, Ottawa.
So big moves by the federal government clearly today to deal with the fallout from this virus. Let's bring in Rosie, our chief political correspondent. So Rosie, can we focus first on that $82 billion?
Yeah, I mean, really just to give you a sense of the magnitude and the speed of this response, Adrian, think back to a week ago when the government was still preparing to table a budget in about a week's time. Today, it announced that aid package, direct spending of $27 billion, plus the $55 billion in tax deferrals. So some perspective on those numbers, last year's budget had $22 billion in new money over 5 years. So that should give you a sense sense of how deep and how long the economic impact of this might be felt. Here's another hint. The Canada's Chief Public Health Officer said today that this virus is going to be with us for some time, and we need to be prepared for another wave of it, given we don't know the seasonality of the virus. So this is really the government's first response, a significant one, to what they are really showing and telling us will last months beyond this initial hit to the economy and even through a second wave of the virus potentially.
And that partial border closure, Rosie, how difficult do you think it was to reach that particular decision?
Well, listen, we know that the Prime Minister and the President have a complicated relationship on the best of days, but from what we understand, what I've been told is that they were able to put aside some of those past dynamics to make sure that they could work out a solution to the border fairly quickly. Canada approached the United States to make sure they could get this done together. And from what I'm told, it took about 22 hours to get this agreement between the countries that this was the right decision. Details, of course, still being worked out, but it was surprisingly uncomplicated. Both sides understood the necessity of keeping the goods and services flowing, and I am told that this deal, this agreement, this new reality at the border will be in place within days.
All right, Rosie, thanks very much.
Okay.
Now, 2 other provinces have followed Ontario, Alberta, and BC in declaring states of emergency. Saskatchewan and Newfoundland and Labrador made their announcements today. And here's what it looks like in the most affected parts of the country tonight. While Canada has now reported more than 720 cases, the big spike was in British Columbia today. 45 new infections for a total of 231. That's more than Ontario now, which has 214. 24 of them new today. Alberta also reported 22 new cases, bringing the total there to at least 119. Now, we've heard many times about the growing need for testing. That's from the World Health Organization, right on down to national and local authorities. So how is Canada doing on that front? Tina Lovegreen takes a closer look.
Day 3 and 11 more to go.
I'm just worried about the most vulnerable people.
Lisa and Anton Smesart are self-isolating after returning from holidays.
We're doing fine, yeah.
And we're setting up for the long run.
They haven't been tested because they don't feel sick, but they don't want to be part of the problem either.
What we do today is going to help us in the next 10 days, 14 days, 2 weeks, or 3 weeks.
The number of cases are multiplying across this nation.
Our scientists project that the viral infection in Alberta will peak about 4 or 5 weeks from now.
And more new cases aren't travel related.
This is a signal there is some degree of community spread, so our time to act is now.
But in Ontario, a lag in test results is making that hard and causing concern.
A 4-day wait is not acceptable, and so we are working on doing much better than that.
We're working to set up 25 dedicated assessment centers across the province to ease the pressure on hospitals.
Quebec, also under pressure, has started drive-through testing. The goal, to test 100 people a day, 7 days a week. And the federal government is expanding testing capacities with 2 newly approved COVID-19 diagnostic tests to help provinces keep up.
If we can't have testing available as needed, then it greatly interferes with the ability to contain this.
Here in BC, testing is reserved for those who need it most: healthcare workers, patients close to hospitalization, or in known outbreak clusters.
Our testing has become more strategic. We are doing more and more of it, and more of it is necessary.
And until that happens,
all we can do is try to not make it any worse. So please stay at home.
With more community transmission appearing, testing becomes all the more crucial. Tina Lovegreen, CBC News, Vancouver.
Now, Dr. Susie Hoda is an infectious disease specialist at the University Health Network, joining us from outside the studio. We are social distancing, of course. And so, Dr. Hoda, what is the end game here in ramping up testing? Is it that we can offer tests to anyone and everyone who wants it?
No, actually, that's not really the goal here. So early on in an outbreak, you want to try and know about as many cases as possible so you can follow up on the contacts and contain things as much as possible. But when you start to get community spread at higher numbers, your goal shifts. And what you're trying to do is identify people who can actually expose the most vulnerable folks in our population who can get really sick from this and prevent them from spreading it So your goal is shifted a little bit from wanting to look for every case to looking for the ones that really matter the most to help control the whole situation.
Right, and I suppose you can only prevent spread if you know who's actually sick. So what's the actual point then at which we can say, okay, all of this social distancing, we can ease up a little bit?
Yeah, it's a really good question, because what you want to do is make sure that you're on the downslope of the curve of infection transmission before you stop the measures like social distancing. If you stop it too early, you risk having another upswing, another sort of wave of infection. And so you really want to make sure you're at the point where there's been enough intervention in place that transmission doesn't happen very efficiently with the virus from person to person, and then you're able to let up.
Okay, Dr. Hoda, thanks for joining us.
Thank you.
So much happening across the country as provinces and cities scramble to respond. Anita Bath is tracking those stories for us tonight.
Adrian, more seniors' homes are being hit by the COVID-19 outbreak. An 80-year-old woman in Hamilton, Ontario has been diagnosed and now a resident at a third seniors facility in British Columbia. There is fear Harrow Park long-term care could become the new epicenter in BC. More than 200 people live at the residence. We know elderly people are particularly vulnerable to the virus. 6 of BC's 7 deaths have occurred at a single care home in North Vancouver. Outbreak control measures are now in place at this new location, Harrow Park, including restricting visitors.
It's been on my mind quite a lot because I'm concerned about the people that live here. A lot of them are in failing health, and it would be a horrible thing if that caught on here. I imagine it would be devastating to the community.
Okay, I want to take you across the country now to PEI, where all provincially owned liquor and cannabis stores will be closed as of 2 p.m. local time tomorrow. The reaction? Well, it was disappointing for the province's medical health officer. Scenes like this, despite her repeated warnings, you can see people are lined up, long lines at the cannabis and liquor stores as everyone tried to stock up today.
We have talked about social distancing. We have talked about the importance of staying at home unless it's essential. And that appears to have been ignored. And, we underestimated that alcohol is considered essential for some people.
Meanwhile, Ontario's medical information line, telehealth, facing major issues today. The province says it is adding 300 new lines, hoping it will help with the number of calls telehealth is receiving. Anyone who can't get through is being asked to call their local public health units instead. All right, now back to Toronto.
Thanks, Anita. Now, health guidance aside, Canadians are also deeply concerned about the supply of vital health equipment, especially ventilators. They want to know there are enough of them should the situation get worse, and if hundreds of cases turn into thousands. Magda Gabriselassie looks into it.
I was asked to show the setup.
Giving us a look at his rural Ontario hospital is Dr. Alain Gauthier. He and his colleagues are preparing for a worst-case scenario, an overload of serious COVID-19 cases and not enough ventilators to go around.
I'd like to show you how to modify one ventilator to ventilate 2.
With the help of this video, Gauthier and his team retooled each ventilator to help save multiple lives.
At one point, we may not have other options. The option could be, well, we let people die, or we give that a chance.
It's a last resort that hasn't been widely tested. Meanwhile, across the country, measures to control the spread continue.
If we cannot keep this type of interventions in place, we're going to run out of capacity really, really quickly.
She's part of a team of researchers tracking available resources. She says in total, Ontario has 2,000 ICU beds and 1,300 ventilators, and canceling elective surgeries can help free up many of them. Even with that,
we estimate that we will run out of ventilators within 16 to 35 days. So that depends on how many new cases do we see in Ontario, how effective our school closures and social distancing is.
Although most people with COVID-19 will experience mild symptoms, in Italy about 10% ended up in the ICU, forcing doctors to choose who gets a ventilator and who doesn't. Today, government officials reassured the public they're getting ahead of this.
We are actually preempting any need for ventilators by purchasing some already.
Ontario's health ministry would not confirm the total number of ventilators today, but did say 300 more have been ordered. And auto part makers are ready to help out too by retooling factories to make more. Magda Gebre-Selassie, CBC News, Toronto.
American health officials are also worried about not having enough ventilators, among other equipment and supplies. They are sounding the alarm that their system is simply not prepared. COVID-19 has spread to all 50 states and the District of Columbia. As of this evening, more than 7,700 people have become sick. More than 100 have died. After Washington State, New York is the next hardest hit. The governor says cases there jumped by 1,000 since yesterday. Katie Simpson tells us what's being done there.
Equipped with badly needed beds and operating rooms, the U.S. Comfort is being ready to set sail for New York Harbor, one of 2 military ships called into action.
This will be, it's an extraordinary step, obviously.
New York's governor says his state can't handle an influx of patients. Today, to ease the strain on the medical system, the president invoked a rarely used law that allows the government to order companies to produce emergency medical supplies.
We have tremendous numbers of ventilators, but there's never been an instance like this where no matter what you have, it's not enough.
A lack of equipment and personal protective gear is a major concern for frontline workers, including these nurses in Minnesota.
The tension in the hospitals and the fear is heavy.
In the event that a patient were to be positive for COVID-19, we're not protected.
Many Americans are doing what they can to protect themselves by following social distancing rules. But that is not the case in some beach communities.
I wanted to come down with my daughter and enjoy the beach before the first wave, right? The first wave of sickness.
A sudden surge in startling information may change attitudes now that the testing backlog is finally easing.
We will see the number of people diagnosed dramatically increase over the next 4 to 5 days.
Donald Trump has been criticized for the slow rollout of tests. He's recently taken on a sense of urgency, but faces new accusations of racism for calling COVID-19 the Chinese virus.
It's not racist at all, no, not at all. It comes from China. That's why. It comes from China. I want to be accurate.
To the president, fighting the virus is a wartime effort. And if everyone has a role to play, public health says staying home is the most important part. Katie Simpson, CBC News, Washington.
Well, in the UK today, Prime Minister Boris Johnson said London could soon see similar lockdown measures to those already in place in other European cities.
We will not hesitate to go further and faster in the days and weeks ahead. And we will do whatever it takes so that we beat it together.
The government will be shutting down all schools across the country starting this Friday. All this as the number of COVID-19 cases in the UK surpassed 2,600. And in Italy, where 60 million people are now in their second week of a nationwide lockdown, the number of cases and deaths still on the rise. Just today, the country reported 475 deaths, its biggest increase since the start of the outbreak. Italy, still the hardest hit country by this coronavirus outside of China.
Besides the border closures and travel restrictions, Canadians are facing sky-high ticket prices to fly home from abroad.
It just really seems unfair and quite predatory, to be honest.
Up next, we look at passenger rights and whether there could be relief in the future.
And Canadians still on the job, making deliveries, working retail.
I don't want to be here, if I'm completely honest.
But do they have to be?
And a creative solution for family visits at a nursing home on lockdown.
You can see him, you can talk to him, you can see that he's all right.
We're back in 2. Welcome back. Canadian Airlines are preparing to reduce service and in some cases ground all flights. It's a response to calls by governments to reduce international travel. Porter Airlines will suspend operations at the end of day Friday until at least June the 1st. Sunwing Airlines will stop flying on Monday. It's now focused on getting passengers home. Likewise, Air Transat is gradually suspending all service until April 30th. And Air Canada says it is phasing out most international flights by April 1st, and domestic service is being reduced. WestJet previously said all cross-border flights will stop by Sunday. So all this means Canadians abroad really have very little time and few options to get back home. And with seats going for a premium, some are accusing airlines of cashing in. As Erica Johnson explains, that has prompted calls for Ottawa to do more.
But they have increased airfares in this time of need.
Carol Reid has just filed this complaint with the airline regulator, upset about what Air Canada is charging her parents to get home. They're visiting family in Chile and just had to spend more than $2,000 to move up their tickets.
I do feel quite taken advantage of. I had to take it because we do have to get back home and get back to safety.
In a time of a national crisis and a worldwide pandemic, it just really seems unfair and quite predatory, to be honest.
We've heard from lots of Canadians with beefs about Air Canada, WestJet, Sunwing, Air Transit, desperate travelers who say they're being gouged to get home. I paid over 3 times the cost of the original flight, writes one traveler. There are flights available at nearly 50% higher price, says another. The airfares are incredibly high, over $3,000 one way. Passengers may not think it's moral for airlines to charge more at a time of crisis, but it's legal. An air passenger rights advocate says Ottawa should demand that airlines give full refunds for anyone unable to use their tickets due to the pandemic. That frees up seats, drives down prices.
The situation here alters the nature of the contract completely. You cannot travel. There's no way you can travel. There's no way you can even travel in the foreseeable future.
The federal government wouldn't address questions about mandating refunds, saying again that it's offering an emergency loan of up to $5,000 to ensure Canadians can return home safely. For travelers shelling out hundreds, even thousands of dollars unexpectedly, this consumer advocate is optimistic they'll be reimbursed.
It's bigger things happening, and I think if we're patient and calm, eventually the money and the return flights will sort out.
Air Canada didn't address the Canadian couple who had to spend more than $2,000 to change their ticket, but did announce special one-way fares to help Canadians get home. Erica Johnson, CBC News, Vancouver.
Well, up next, from the hand soap you use to the medication you take, we put your coronavirus questions to the experts.
First, though, we want to show you how a nursing home in Nova Scotia is working around restrictions. Family members can't visit inside, so they got creative and set up a couple of chairs outside a window. Here's the view from both sides.
I feel at times very stressful, but my daughter and I, we have talked about it, and she keeps telling me that I'm in the safest place possible.
You feel comforted because it's safe, and you know that you're not going to have the anxiety of bringing something into the residents.
I appreciate being able to look at her through the window and talk to her on the phone, and that gives me great comfort.
It's better than not being able to see them and worry about them, so you can see them, you can talk to them.
The only thing that really bothers me is I can't touch her and hug her. I'm a huggy person and I like to be hugged.
I think it's a wonderful idea, so I'm quite thrilled to be able to do this, and as long as it takes.
Welcome back. With the COVID-19 outbreak accelerating as quickly as it is, so too have the number of questions that you have. So every night going forward, we are setting time aside on the program to answer those questions. Joining me now, Dr. Susie Hoda and Dr. Isaac Bogosh, both infectious disease specialists at the University Health Network, and both joining us from outside the studio as we continue to practice good social distancing. Hello to the two of you. Dr. Bogosh, let's get started with question one. This is one that we've actually gotten a fair bit. Does the kind of soap I use to wash my hands matter?
The short answer to that is no. Any soap should do, and if soap isn't available, hand sanitizer with at least 60% alcohol should suffice.
Any soap should do, and does it matter if it's a bar soap or soap out of a bottle, like a plunger?
It really doesn't matter. It really doesn't matter. Soap is soap is soap. It'll work. It's effective. And again, I think the key thing here is hand hygiene. So if it isn't available, but someone has hand sanitizer, that's fantastic, as long as there's at least 60% alcohol in the hand sanitizer.
All right, good point. Question number 2 to Dr. Hoda. Does practicing social distancing effectively mean self-isolation, staying at home?
It's not exactly the same thing. I mean, both of those things are trying to aim at achieving the same thing, which is trying to prevent people from being in close contact so that, you don't have transmission of the virus. But social distancing is really just trying to keep your distance from people, but you're able to leave the home and do certain things, whereas self-isolation means you stay within the home. You really limit the number of people within your household that are even going to be in contact with you in the same room, and you're careful about things like sharing items in the house.
Okay, Dr. Bogosh, third question, a bit along similar lines. Is it safe to travel within Canada to spend time with, say, family?
In general, I think that really kind of goes against the principles of what we're really trying to achieve here. And of course, I appreciate that some people have to travel. There might be a sick relative or something that's really urgent that someone has to go to. But in general, it's really time to stay home. It's really time for social distancing measures to be implemented widely. And traveling, even within Canada, kind of goes against that.
And so if you travel interprovincially, when you come back, should you self-isolate in the same way that you're supposed to when you come back from out of the country?
No, not yet. Those measures have not been taken just yet. I don't know if we'll get there, but certainly that's not the case right now.
Okay, Dr. Hoda, this is one I've seen a lot online. Do anti-inflammatories really make you more susceptible to the virus? So we're talking things like Advil, ibuprofen.
I don't think we really know an answer to that at this point in time. We're not giving advice for people to avoid taking those medications, although there are some questions about, whether or not that might affect your outcome. I'd wait for some more data to come out.
Yeah, Dr. Bogosh, I mean, that is something we've seen circulating online, though. I mean, where did that come from?
I think there was a French official that had raised this point, and then it kind of took off from there, but we really don't have any data to support this one way or another.
Okay, last question, I want to go to you. How much worse is this going to get?
Sadly, we know it's going to get worse, and certainly day by day we're going to see more and more cases. However, it is truly up to us to see how we can mitigate this. And if we really all roll up our collective sleeves, practice social distancing, which means a lot of things like working from home and really staying apart from one another, we can really ensure that this doesn't get too bad.
And Dr. Hoda, I'd like you to take on that same question. How much worse do you think this is going to get?
I completely agree. I think we're going to see more people get sick from COVID-19. I think we were expecting that. We're trying to prepare to deal with that by using these interventions like social distancing to try and help the system cope with it.
Dr. Hoda, Dr. Bogosh, good to have you on. Thanks.
Thank you.
Now, as we mentioned, we will be asking your questions about COVID-19 every night going forward, so send us the questions that you have. You can message us directly on Instagram at CBC The National, or hey, you can send us an email at thenational@cbc.ca.
When it comes to fighting COVID-19, it is clearly all hands on deck. Ahead tonight, we'll take you to a distillery that's stepping up to make free hand sanitizer during the crisis. First, though, a little story about love in the time of coronavirus. Esther is Canadian, James is American. They were supposed to get married next month, but with today's border closing, they just decided to act fast.
I was already mourning the fact that when the wedding takes place in April, as we thought, we would not be able to cross the border. I could see it's going to close, and I thought, we're going to miss it. And I am so thankful that we're here right now.
Not everyone could make it, so just like we all are these days, some family teleconferenced in. The happy couple, of course, is waiting to plan a honeymoon destination. Congrats, you two. The message is coming loud and clear from government and health officials right now. People need to stay home to try to slow the spread of this coronavirus, but not everyone can do that. In situations like these, we rely even more on frontline workers, including those at hospitals and clinics. Nick Purdon takes us to Humber River Hospital in Toronto, a place designed with lessons learned from the SARS outbreak to see how medical staff are managing.
I'm here at the Humber River Hospital in Toronto to find out how frontline medical workers are coping with COVID-19.
And that's going to evolve, I think, every day.
Janelle Van Haltren is an emergency nurse.
We know we are the frontline staff and we have to be, on our toes to accept whatever comes our way. So just trying to stay prepared.
What's the biggest challenge right now?
I think the challenge is not knowing what to expect with flow of patients and how many are going to come in and how to prepare our department for the possibility of more sick people. A lot of people are scared. Many of them come in not sure. They don't really know why they're here. They just know there's a virus and they want to get checked out.
Here at this hospital, there's been at least one positive case of COVID-19. And like anyone, that kind of news has Janelle concerned about her own family.
My mom has cancer, so she does have, she's immunocompromised, so that's always a risk for me to come home to bring it to her. I mean, she's a nurse as well, and my sisters are all nurses, so we're very used to these things, and she worked through the SARS pandemic as well, so it's something our families, have a little bit more history with, but I am at risk to get it, right, from working, so.
Okay, I think that's all I wanted to tell you.
The person in charge of Janelle's safety is Natalie Farsate.
Thank you so much.
She's the Senior Director of Health and Safety and Infection Control.
Because some of the nurses are scared, right? So.
And it's okay to be worried.
What do you worry about your staff?
I am worried about my staff taking the strain that our community puts over on their shoulders without pitching it.
What Natalie is talking about are the Canadians who have ignored the social distancing recommendations. When you see people out as a healthcare professional, what do you think?
It makes me very angry because while we're doing the right thing within the walls of the hospital, we cannot control what happens outside. Pandemics are community events, and we need every single person in the community to pitch in. People who carry the virus and may have mild symptoms have a weapon that can wipe out potentially entire generation of people over 65 who are significantly affected by the virus. So people carry a weapon. People are the weapon.
Makes you wonder how much stress Janelle is actually under. Did you ever consider throwing up your hands and saying, I'll come back when the pandemic's over?
You maybe never expected that you would go through a pandemic as a nurse, even though you know that possibility is always there and you're putting yourself at risk. But that's why I picked nursing. I joined nursing to help. It's a helping profession. I want to be there when people are at their finest moments, maybe having a baby, but also at their worst moments when they're facing death or a disease such as this. And same with the rest of my team in emergency. We love helping people and we're there for you, and we're able to keep a calm face during something like this, and that's just what we love to do.
As the pandemic worsens, we're lucky to have people like Janelle on the front lines. Nick Purdon, CBC News, Toronto.
And it's not just healthcare professionals and first responders bearing a broader risk of infection. There's a whole army of other workers out there keeping things running. Cashiers, couriers, retail workers. Chris Glover looks at how they're holding up.
Hand sanitizer that they've sent us and given us a few bottles of, which you can see we're almost out of now.
Only 3 bottles of hand sanitizer from head office, so a coworker provided the wipes. This EB Games employee is afraid to lose his job, so we aren't revealing his name.
They're saying that they want to look after us and keep us safe, keep the customers safe, but at this point I feel like that's not their main concern. Their main concern is to keep the stores open and making money.
Working with no protective gear, he raised concerns on a corporate call yesterday, but says he was told, suck it up.
I don't want to be here, if I'm completely honest. Coming in because of my staff, basically, to be the leader in the store and show them that, everything's going to be okay, but I personally don't feel okay.
EB Games won't return our calls, but even at this Loblaws supermarket, we saw frontline workers without protective gear. In a statement, the company said we continue to follow the guidance from public health.
If the employer's not doing that, stay home legally. The employer had better pay you and will have to pay you if that occurs.
Even if you choose to stay home, this employment lawyer says you can't be fired or the employer can be sued.
People do not realize the protection they have, and employers don't realize the liability that they have.
And we're not doing signatures. So
but for some, going without a paycheck isn't an option. This courier says right now customers aren't allowed to touch his machine.
We have this code CRSS, and then I just put in the name right there and close it up and on to the next one.
At EB Games, promotions are ramping up and a major release is set for Friday.
I don't want to put my family or anybody in my close circle at risk that way, and right now I feel like I am.
This worker fears the potential danger will only increase. Chris Glover, CBC News, Toronto.
Up next, an Ontario business switching gears to help protect Canadians during this crisis.
We're making as much sanitizer and disinfectant as we can.
A distillery doing its part. And wait until you hear about the response they've been getting. We'll be right back. Well, hand sanitizer is clearly a hot commodity these days. Health officials say products containing at least 60% alcohol can kill the coronavirus, but you may be hard-pressed to find any. Store shelves across Canada have been picked clean, and there are reports of price gouging online. So enter Dillon's small batch distillers. They have gone from making spirits to hand sanitizer and disinfectant, and they're giving them away for free to those who are most in need. A CBC News crew stopped by there today for a peek behind the scenes.
I'm Jeff Dillon. I'm the founder here at Dillon Small Batch Distillers down in Beamsville, Ontario. Normally we'd be making gin, but today we're bottling up over 3,000 bottles of hand sanitizer to go out to essential services. Normally we are a gin and whiskey distillery. We're making lots of different gins, some fun rye whiskeys. Things took a turn on Friday. So we started making a small little 30 ml bottles of hand sanitizer. We found some aloe. And we said, well, we could add some alcohol to that and make it a nice little hand sanitizer, give it away to people that come in. And then the word spread, demand just kept growing.
They bottled the disinfectant already, but we are just working on the hand sanitizer right now.
So by Monday night, Whitney, who runs the front here, she texted saying, you know, I think there's probably more we can do. And we sat down and said, all right, well, what can we do? And we came up with a nice strong 65% alcohol. It's using our heads and tails, so it's not potable, but it's 65% alcohol, enough to kill the bacteria and viruses, and bottle that up and get it out to the people that need it.
RCMP. I think I have about 1,000 emails that have come in over the last less than 24 hours. The phone is ringing off the hook, so there's definitely people in need of it. We're hearing from ICU nurses and ER doctors that don't have access to hand sanitizer right now, and there's, you know, some pretty heart-wrenching stories out there of people that are just trying to keep their families safe and healthy.
I deliver medications for people that need them on a daily basis to get through the day and the week and the months. I'm here getting hand sanitizers to keep us clean, because we got to make sure that we're clean to help the other people that they're healthy too.
My wife is in healthcare. She's a primary care pharmacist, and I thought it would be great that she had supplies on hand when she needed it. So it goes both ways, right? It goes both ways. We've got people in healthcare who are helping the community, and those in the community who want to support them. So that's why I'm here.
Everyone's kind of scared. All the news is negative, and you know, your stories of people hoarding toilet paper and sanitizer. And if we can do the exact opposite, do something positive, then I think that's a big win for us and anyone we can help.
Oh, that's pretty cool. Okay, up next on The National, a global birthday celebration in the midst of this coronavirus.
To see Nixon and Happy Birthday Nixon trending all over the world was unbelievable.
Our moment is next. Well, this little guy here, Nixon, turned 7 years old yesterday, but because of COVID-19, he couldn't have a regular birthday party. It can be hard for kids to understand why everything around them is suddenly getting canceled or closed down. And Nixon's dad, to his credit, still wanted to do something special to celebrate, so he turned to Twitter, and what came back is our moment.
Yesterday was my 7-year-old son Nixon's birthday. He was super upset that his birthday party got canceled. I thought, how cool would it be to cheer him up a little bit by putting out this message and having people write happy birthday to him. And I had over 11,000 messages.
From all the Ghostbusters, happy birthday.
It's Jake Tapper here from CNN. I'm here with another friend.
Hey, Nixon, it's Wolf Blitzer from CNN, The Situation Room. Happy birthday.
Next thing I looked, and it was the #1 trending thing in Calgary. Then it started trending in Canada. Then it started trending in worldwide. And like, it's so heartwarming, especially in, a time right now where there's so much uncertainty and a lot of people are panicking and scared. To see Nixon and Happy Birthday Nixon trending all over the world was unbelievable.
And Jesse took it even further because he turned reading the tweets into Nixon's homework.
Right, yeah. And I bet he would have enjoyed every single one, too. Because so funny thing, yesterday was my younger daughter's birthday as well. She just turned 3. And, I posted about it on Instagram because it was kind of a quiet birthday party, as one would expect. So many friends and family sent us happy birthday videos and well wishes, and she watched those videos over and over and over again. It was something special.
Perfect. Chloe, hope you had a good birthday. Go to bed. That is a national for March 18th.
Good night.